the topic of this conversation is a really, really important one when it comes to this technology and other emerging technologies in the VA. We're talking about privacy, data privacy. We're talking about ethics in healthcare, health information security, and all the things that go into that. So while it may not be, I know we use this a lot today, the sexiest conversation, is an incredibly key conversation to be having to make sure that the technology that we're integrating into VA healthcare is being done so in an ethical, responsible way, and that we are considering all of the different facets of the data that's being captured and transferred and used related to this technology. So with that, I'd like both of you to quickly just introduce yourselves. And the first topic of conversation is just how is your team currently supporting, or how do you foresee your team supporting the implementation of immersive technology in the VA?
Should I start? Can you hear? Yes, you can hear me. Good morning. I'm Toby Schonfeld with the National Center for Ethics in Healthcare. It's our job to look at strong ethics practices in the delivery of healthcare, in the practice of research, and in the operations of healthcare, right? So healthcare management and how we do the work that we do every day. So innovative technology like the immersive technology we're talking about here crosses all of that, right? So we're using these innovations in clinical care. I think as you saw some out there, we're doing research to make sure that we're getting responsible, that we're getting data about effectiveness and transferring that, right? And we're using it in various operations in healthcare. And so our job is to help make sure that people are anticipating issues ahead of time so that they can be addressed and risks can be mitigated, because the worst thing that would happen, right, is for a veteran to start to use a device and we would have to take it away, especially if they're getting good benefit from it. Or if they get it and it actually doesn't end up working the way we had expected it to work because we had to turn off some of the features because we're worried about their data transmission. So we're working with all of the teams that you've seen already today to try to ensure that we've got systems in place to ask questions ahead of time so we can anticipate issues.
Matthew Baum, I'm with the VHA Healthcare Security Office. Our mission is to ensure that any health information is following the requirements that HIPAA calls for under the security rule. And also, we have the unique position of also dealing with FISMA, and anybody that's dealt with that understands the things with that. As far as immersive technology within the VA, once the privacy requirements have been established and once the ethics has been addressed, it should be coming to the security folks saying, okay, this is what we need to do. This is how we see the requirements develop. How do we make it secure? And our job for our office is to be an enabler, not an impediment. So taking the privacy and the ethics and the baseline security requirements we have for our environment, how do we take the immersive technology and make it work and not hold things back? Like Toby was saying, taking away features in some respects, the reason why that happens is because there's a security concern. Mm-hmm. The data is going places it's not supposed to. People are accessing the data that aren't supposed to see it. Or people are taking that data and they're using it in a way that they're not supposed to. So my job and the job of our office is to make sure that those things, those requirements from the security side, not necessarily prevent that from happening, but put us in a position where if it does, we know about it quick. Not after something gets into the newspaper or we get a letter from Capitol Hill because a veteran is not happy about what's being done with his data.
I think, on that topic of conversation, you've been working in this space. What are some of the most important lessons that you learned, maybe with other emerging technology or other technology implementation in the VA that maybe we can learn from related to immersive tech as we start to integrate this into VA systems?
Well, let me start with the vendors, because that's where all the technology comes from. The security and the privacy stuff needs to be baked into the development of the devices and the software. That's one of the things. Retrofitting security can be a real problem. And we deal with that not as much as we used to, because people are starting to get that. So if you know the type of data that your system and your applications are going to be collecting, that's when you look at what is it going to be used for healthcare? Is it going to be used for making healthcare decisions? If that's the case, then your HIPAA security rule comes into play once the privacy side says, yes, we want to use this and take this data and put it in as part of the health record for the patient. The other thing that the vendors need to realize is that when you introduce something into the federal space, things are a little different than they are in the private sector. You have more requirements that you have to meet. For instance, if you're in a cloud environment, you have to look at the possibility of HIPAA or of FedRAMP. If you're not going to go the FedRAMP route, then you have to look at another third-party certification that your company can use in development of the devices and the software. That can be a bonus, because once you get into the federal space, you can say, look, here's our due diligence, this is what we did, here's our certifications, here's our high trust testing, here's all of the information that we have that shows that we've addressed the risk factors that we're aware of within our software and within our technology. Which makes my job a lot easier, because then we can take that, and there's such a thing called reciprocation. And that can cut down the amount of time it takes to get through that federal security process.
So I would say from our perspective, innovative technology reintroduces an older problem, right? Which is that in healthcare, as in many aspects of life, everything's a balance, right? We have an opportunity and an obligation to invest in innovation to improve the care we give to veterans, right? That improves their quality of life. We also have an opportunity and obligation to make sure that there aren't additional risks that come along with that. And so we've got to figure out what the trade-off is of that. And so a couple of examples of that, right, are thinking about what control do veterans have over the data that they are sharing with the company, right? So, and if they have limited control, how are we explaining that to veterans? And what are their options, right? Is there an option for a device that over which they have more control? There is, I think, the lure of something like the technological imperative, right? So this technology is amazing, and yet one of the things that we know from the history of technology development is that there will be unintended consequences. And my favorite example of that is something very simple. I talked about this at the AI Summit last year, which is the development of the stethoscope, right? So the stethoscope was developed because a physician was uncomfortable putting his ear on the torso of women to try to hear better, right? And said, maybe there is something I can create that will facilitate that. Hence the development of the stethoscope. It did enable that physician to be further away from a woman's torso, right? We know what we're talking about there. But what it also did was it made lots of things available and accessible that weren't, right? So we all of a sudden heard all sorts of different kinds of murmurs and lung sounds that we didn't know before and we hadn't always anticipated. So our job is really to think about what might some of those unintended consequences be, anticipate what we can so that we leave mental and physical space to think about then what comes that you don't expect, right? And then the third thing I would say is that we have an obligation to make sure that we are collecting good data, right? Now, not always complete data. We make decisions in eras of uncertainty all the time. Our data are almost always incomplete. But there's a point at which our data become unreliable, right? And so we've got to make sure that we have good evidence base to make the kinds of healthcare decisions that Matt was referring to.
Well, I definitely agree with that. We're doing our best to capture some really good data. As Anne mentioned, we've got a new person on our team that's going to be helping us to really strategize about the data as well. I know Camilla Jackson from Privacy wasn't able to join us today, but I know the VHA Privacy Office is also very focused on the data aspect as well and helping us to better determine who owns the data, right? So there's a lot of factors that go into deciding who owns data when it comes to these devices and any data captured related to the use of the devices. I always tell people it kind of comes down to two initial questions: who is using it and where are they using it? Because that's how privacy is able to determine a lot of those initial judgments of, okay, no, this is VA-owned data, or no, this is actually basically patient-owned data. They own the rights to that data. And it's really helpful for us to determine that as an organization so that we're taking that into account as we're providing these devices to patients or to clinicians to use. With that in mind, Toby, are there any additional measures or actions that we should be taking to ensure an ethical approach to using this technology in practice?
Yeah, so I think that, the most important thing is that we have a systematic approach and analysis, right? So that we are subjecting every innovation, every device to the same set of questions, right? So, and that's about data ownership, but it's also a little bit broader than that. And the reason I think it has to be systematic is twofold. Number one, I think that's the fairest approach, right? Procedural justice is something we think about in ethics, right? And it makes sure that all of those vendors and veterans have equal access to the work. But it's also important because the systematic approach ensures that we're not going to let anything through the cracks, right? There can be, and my guess is in those amazing slides that Ann showed in the beginning about the pilots, my guess is there may have been some things that showed some benefit, right? So that individual veterans may have had positive experiences, but overall may not have addressed whatever the issue was, right, that they were designed to address, right? And so we have to have a system that enables us to discern that sort of work. So we think about it this way, and so I'm going to minimize sort of the data part because I know that's what, that's Camilla's area and some of what Matt deals with. But aside from that, I think there are sort of 4 core ethical considerations that we need to think about when we're thinking about immersive technologies. So, and these may be issues that you haven't thought about in this way. So one is this notion of stewardship, right? So what are the justifications for us devoting resources to this technology as opposed to other things, right? And so if we had unlimited resources, time, money, people, we could invest in lots of stuff, but we don't, right? Congress gives us a certain amount of money and lots of things to do with that money, and we have 9 million veterans to serve, right? And so we have the responsibility to be good stewards of our resources. And so we have a responsibility to investigate new things, but how do we judge, right? What's the best use of those resources? The second, and it's related, is proportionality, right? So if we have a large percentage of our veterans that are experiencing a certain condition or a certain issue, that might justify more investment of resources in that than in the smaller, right? Now, this is true in healthcare in general. That's how you get actually what we call orphan diseases, right? So there's not enough research. So we have to be careful with that, but we think about proportionality. We also think about equity. Technology can be used and should be used, right, to mitigate bias, right, and reduce inequity, but we have to look for that, right? And so that's one of the things that we need to do as we're analyzing the data, is make sure that our technology is helping our account for bias and not making it worse. And then last I've mentioned is choice, right? So part of respect for veterans means being transparent with them about what we're doing and why we're doing it, and giving them the options, right? What are functionally equivalent options to really address their issues. And I think innovative technology can do all of these things. We just have to account for them at the beginning.
I would very much agree with that, and I think all 4 of those are incredibly important to bring up and enables us to be a bit more responsible in the way that we think about the technology, so that we're not just thinking of, okay, well, patient outcomes wise, that patient loved it, right, which is incredibly important to us, but there's also other really key considerations when it comes to all 4 of those pillars as we're talking about ethical responsibility too. Right. So I think collaborating with ethics, with health security, with privacy, actually having those important conversations allows us, because I'm not an expert in those topics, Ann, Evan, our team, we're not experts in those topics, but you guys are. So it really helps for us to keep those lines of communication open, even at the very beginning, so that we're making sure we're taking that into account and making really good decisions for the organization and for our veterans. So, Matt, I would ask you the same thing. Are there any other measures that should be taken from your experience, or just an insight for us when it comes to specific security measures that need to be in place related to this technology?
Well, you were talking about the privacy part of it and data ownership.
Yep.
From the vendor's perspective and from the patient's perspective, if the vendor is opening this up to patient use and the patient is owning the data, one of the things that I have seen in my experience is the privacy statements and the security statements that are on those portals, they have to do a better job to be clear.
Yep.
There can't be ambiguity. When there's ambiguity, that's when you wind up getting into problems.
Yeah.
If the patient's going to own the data, state it clearly. If you are going to be describing how you protect the data, don't say, we protect your data. Okay, what does that mean?
Prove it.
Yeah, and that's where our office, we see statements like that, we come back to the vendor and say, give us the details. How are you doing it? You don't have to get into the techniques of how you're doing it, but from the patient perspective, they want to know, we follow HIPAA. We do this, we do that. We encrypt your information when it's stored if you decide you want to keep it. Those are the kind of things that help us do our job on our end. It also helps when you give the patient the option of whether or not they want to share their information, which makes it easier on us, because from the security perspective, what we do is the due diligence is the vendor protecting the information. When we want to bring it in, are we bringing it in through a secure channel? Is it encrypted when our clinician logs into the portal and wants to pull it in? Whether it's a PDF, whether it's over time a graphical representation of the treatment cycle, however that is. That's the other thing in my experience that really helps. But it's the privacy statements and the security statements and making it very clear to the patient and the clinician, because the clinicians are users as well.
Yep, they are.
But making those statements very, very clear. It's really important from our side that we understand when we read that. Patient owns the data. The vendor is doing X, Y, Z to protect it. And when we want to pull it down, we know that we're going to be pulling it down through a secure channel into our environment. And once it's in our environment, then it's our responsibility to protect the patient information.
Do you think, to that end, do you think it's important for the clinicians who are ordering these products for their patients to also have visibility on what that language is that patients are agreeing to?
Absolutely. That's a lot of times in my experience, the clinicians say this real shiny object that really is going to benefit the patient. Yeah. Terrific. But the clinician has no idea what's behind that. This really neat device that I know is going to help my patient. They don't have to know the nitty-gritty, but they should understand, is the VA going to own it, or is the patient going to own it? And then the patient has to say, I want to share it with Dr. Davis. Yeah. And then when they come to us saying we want to implement this new technology, we want to evaluate it, we want to do it in a pilot, we have some specific questions right off the bat. Do you have any security information so that we can understand how this platform and technology functions and how it's being protected? Is there something we're going to have to do on our end if we bring it in-house? Something that we have to add to it in order to meet our requirements as a federal agency. So from the clinicians, there should be some guidance out there for them to understand that you don't have to know everything. You don't have to be what we used to call propeller heads with the digital technology. That was a long time ago. That was in the mainframe days. But for the clinicians to have a basic understanding so that they can make an informed decision based on the technology that they're seeing, not just from what a salesperson has shown them in a demonstration.
Agreed.
I think that is absolutely important, and it's one of the reasons why, within VA Immersive, we do try to build a lot of different resources for our clinical staff too. Reference lists, different guides, clinical guides, because we want them to be able to make informed decisions about the products that they are prescribing and ordering for their patients. Everything from what it's intended to do, how the patient's going to use it, what data is captured, what isn't captured, are they going to have access to that data? What is the patient signing if the device is going to their home and they're signing off on it then? But I think all of those things are incredibly important in making, being ethically responsible.
Well, and I think that actually connects to the biggest risk if we don't do this well, right? I mean, there are some risks about perpetuating or creating new inequities, right? There are risks about inappropriate investment. But I think the biggest risk, if we don't think about this, is the potential to lose trust of veterans, right? Because the reason that the clinicians need to know that information is because veterans don't trust the technology, they trust their provider, right? And I'm actually really surprised Dr. Elmhall did not mention, because he's mentioned in every meeting I've been with him in the past 2 weeks, right, that our trust scores at VA are the highest that they've ever been. And it's not trust in technology, it's trust in us, right? And so just like people see their clinician, it is whether the technology uses AI, uses machine learning, uses any of that stuff. It's humans who are accountable, right? And it's humans that make that connection. And so if we don't do this well, we risk the most important thing, which is losing veterans' trust in VA and in us as healthcare providers, and that you can't get back, right? So
I would agree with that, absolutely. I know we have about 6 minutes left. How do you two feel about opening it up to the crowd for any potential questions?
Sure.
Yeah, I know this is a pretty heavy topic. When it comes to privacy, information security, ethical decision making, it's a very heavy topic, but it's an incredibly important one as technology continues to grow and expand. So if anyone has a question, we have someone with a question right here.
Thanks. So as we break into the home environment with VR, how can we best equip clinicians with the knowledge that they need to make those right decisions on equitability and also economically speaking when they're choosing VR devices, to include sort of the data piece as well? How can we equip them with that knowledge and skill that they need without burdening them?
Yeah, it's a really good question, right? And the equity, I think about moving in people's home on one hand, and we learned this from COVID, right? And the increase in telehealth that Dr. Campbell and others have talked about, right? On one hand, it increases access, right? Because you don't have to go anywhere. Unless, of course, you don't have technology, you don't have Wi-Fi, right? You're living in a rural or an underserved area. And so there is a real risk that technology, especially if it requires being connected to Wi-Fi, for example, right, that there will be an inequitable distribution of the technology. So we worry about that, just like we worry about the underlying algorithms, right, that go into program some of this work and the data that we get from it. We want to make sure that we are using this and getting information on a wide swath of veterans so that there isn't bias perpetuated in these algorithms. So I do worry about that. I also worry about people for whom there aren't many other options. And so choice has to in order for choice to be authentic, there has to be something that they're choosing between, right? And if it's this or nothing, that's not a real choice, right? And so what is this? Is this a choice between this or attending a group or, that sort of thing, which might work for some veterans? And so I think we have to think about all of that. There are advantages that you get in doing it at the home, but there might be some things that you lose, like some of the peer support, right? And we keep talking about gaming, right? Lots of people game online with people all over the world, and that actually creates an interesting peer network. So we could enhance the peer network of some folks from their home, but for others, we can't, right? It's not the same thing. They value the person-to-person contact more. So we've got to figure that out and help to give veterans that choice, even when it might be more difficult to get that veteran to a medical center, but that might be more beneficial for that veteran.
Mm-hmm. Yeah.
Taking that on the security side, one of the things that we experienced with the COVID was you want to make sure that the security requirements, let's say to log into a system, don't impede the patient's ability to actually use the technology. If you make logging into a portal difficult, or your security requirements are so strict that the lowest common denominator veteran, who could be homeless, cannot get into the system to use and get the benefits of that system for their health care. So from the security side, that's another aspect that you have to think about when you're looking at, okay, who are the users going to be? What's the makeup of that? What's the use case for those veterans or those patients that are out there? When the industry was starting to go into the two-factor authentication, that was one of the big things from the security side that was causing an ethical problem. How are these veterans at the lowest common denominator for a user case? How are they going to be able to benefit from using this technology, or is it going to be so restrictive that they're excluded? And that's a non-starter for me from the security side. That's a non-starter. There should not be security in place that is that strict that they can't benefit from the use of the technology. And in some of the processes that I've been involved with at the VA, we do due diligence, even though we may not own the data or the platform. We want to make sure that that information is secure, because if something goes bad, the worst thing you want is getting a letter from Capitol Hill saying, what are you doing telling veterans to use this stuff when it doesn't protect their data? Yep. You don't want that.
Nope.
We don't want that to happen.
We get that. We don't want that.
Right.
No, we do not. Laura has a question over here, too. Oh, he's coming. He's coming.
Hi there. I'm wondering how you think about that in the early stages of testing these technologies when they're piloting and maybe not a lot of investment has been made yet on hardening them for, long-term use and things like that. How do you think about the ethics, the security, the privacy in the early stages of trying them out?
Can you restate the last part of that question?
How do you think about these responsibilities for ethics and equity and security and privacy in the early stages of testing technology out, where we don't necessarily know the answers to those questions yet, but you want to explore what the benefits are?
The privacy and the ethics and the security should be basic building blocks at the beginning of any thought of a particular type of solution. So if you say, hey, this would be a really good idea, let's see if we can create an application, or we can create a solution to help patients do this or this, remote locations, let's say. Well, that privacy and the ethics and the security should be the building blocks, not just with the code developers, but it should be from the healthcare business side. And when I mean business side, I mean clinical side. You take all of those things together when you start to develop whatever this neat idea is. And that's what, when I say baked in, when privacy and ethics and security are baked in, it's from the very beginning when somebody comes up with a concept.
Yeah, so I would just say very quickly that two things. One is that you need to think about what kind of data you need to collect. So what are the questions that you're asking, right? And what's the data that you need in order to answer that question? And just like everything in healthcare, a process of shared decision making with the veteran, with the patient, to say, this is what we know, this is what we don't know, this is why I think it could be helpful. Let's talk about what your values and priorities are given this information. And that helps to create better decisions.
I think that was a great way to end the conversation about ethics and information security. I know we are out of time. I want to thank you both for your time today. I do think this is an incredibly important conversation, and I'm grateful to continue to collaborate with you both. We're around immersive and around all emerging technology. I know we're on the E3 Alliance group together as well, but thank you for being here.
Thank you.
Thank you.